patients are worried about anaesthesia, often raising with me its safety, being certain they are not awake during surgery and just a general experience. Today I have two experienced anaesthetists on my team who both specialise in bariatric surgery to talk about these things. I'm extremely proud to be working with this skilled surgical team. Dr. Hunt has worked as a consultant anaesthetist for over 10 years, while Dr. Goody has been at the forefront of many developments in anaesthesia for weight loss surgery. He's also a former instructor in anaesthesia at the Harvard University Medical School. So David, a lot of patients often ask me, will I wake up during the operation?
John, we call this event awareness, and it does happen extremely rarely during surgery, but neither Cameron nor myself have ever encountered it. We know it's more likely in emergency surgery, with patients who are sick, or with certain anaesthetic techniques, and none of these apply during bariatric surgery. In addition, these days we use monitors to measure the depth of anaesthesia, which makes the risk even smaller.
So Cameron, one of the other questions I get is it safe? Is anaesthesia safe for the morbidly obese patients? In other words, what are the risks of anaesthesia in this patient group?
We know anaesthesia is safe for weight loss surgery because the Bariatric Surgical Registry tells us that over 99.9% of patients survive. And to put this in perspective, it means that you're safer than when you're driving a car. We know for other significant complications, like the chance of developing a blood clot, that it's lower, approximately a third the risk compared with hip or knee surgery. So yes, overall anaesthetics for weight loss surgery is very safe.
It's reassuring that the risks of bariatric anaesthesia are very low, but there are risks with anaesthesia and surgery for any procedure. These risks, of course, have to be weighed up against the risks of not having surgery. In a morbidly obese patients, these risks include a much higher chance of premature death, mainly due to cardiovascular disease, heart attack and stroke, diabetes, sleep apnea and other problems such as arthritis, depression that accompany being significantly overweight.
St George Private is Australia's busiest weight loss surgery hospital, and it's the first hospital in Australia to receive a Centre of Excellence recognition from the Surgical Review Corporation. But many patients take great comfort in this recognition and that the whole team is working to one end: their patients' optimal recovery after bariatric surgery.
David and I will always meet with our patients and talk with our patients before the surgery with Dr. Johnson. And at that time we can address any other questions or concerns they might have.